Talk about the main planks of Singapore's healthcare system. It's called the 3Ms. What exactly are the 3Ms?
3Ms is a bit of our own invention, and because it represents three different schemes: MediSave, MediShield, and MediFund, and for three very different purposes. MediSave is, I think the US would call it health savings account. In other words, people save every month into an account from which they can then use it to pay for their medical needs, both for themselves as well as for the family. We started this quite early, more than 20 odd years ago. So it has built up to quite a significant amount from which we can then draw to pay for hospital bills when we are sick or when our loved ones are sick. Some difference between our MediSave and the US health savings account is because we make it compulsory. Yeah, so every workers every month have to save 6% of their salaries into this MediSave account, and the account can only be used for hospitalization of the person or the family members. I believe in US your health savings account is voluntary. So that's the first M. The second M is MediShield, which is an insurance scheme. So the Americans are familiar with healthcare insurance. So you buy insurance so that you pool the risk. But again, there are some key differences between our MediShield and the US insurance scheme. In US, insurance scheme is what we call comprehensive health insurance. So once you buy the policy, and if you are sick, you go to hospital, the insurer will typically pay practically the bulk of the bill. So the patients then pay very little at the time of consumption. But we make sure there's a deductible to it. So it's a little bit like motor car insurance. So when you purchase a motor car insurance, if you get into an accident, the first, let's say $500, you have to pay yourself. And only if the amount the repairs exceed more than $500, then the insurance come in. The deductible has a very important purpose, which is to cut down abuses. So you don't want frivolous claims. You may have an accident, but maybe only a slight dent, which normally you would just forget about it. But the insurer is paying for it from first dollar. Of course, I'll claim. And typically you find in the motor car repair workshop, if the mechanic knows that the car is insured, you will suddenly find that the whole car is repainted, tires are changed, wheels are changed, etc., even though they may not be necessary. So those are typical abuses that we find in the motor car industry and in healthcare too. So if it is comprehensive first dollar coverage, abuses tend to be a lot higher. Mm-hmm. So we insist on this deductible. Right. And of course, the final pillar, the last M, MediFund, that is a government endowment fund, because patients, for various reasons, because they may be very congenitally sick, more sickly. So even though they may have MediSave, they may have bought MediShield, and yet they may not be able to pay the deductible. So of course then the MediFund comes in. It's really like a safety net to help out the poor. Mm-hmm. So I think through these three pillars, we make sure that healthcare of very high standard and therefore costly, but yet it is affordable to the masses.
Mm-hmm. And are all three compulsory? Does every Singaporean have to buy into all three, or is it just MediSave that the vast majority of Singaporeans are obliged to pay into?
Only MediSave is compulsory. So MediShield is voluntary, but we do it in an opt-out manner. So now, if you don't opt out, I assume you are in, because typically opt-in scheme, there's a lot of inertia. So people may not come forward to go and apply or to buy into insurance until they fall sick, and then it's too late, because once you are sick, which insurance company will sell you a policy? So it is mainly to overcome this inertia. So we make it an opt-out scheme. So therefore, for example, a newborn, so when the baby is born, within a few weeks, if the parents do not object, then we assume the baby will be insured by MediShield. And of course, we deduct the premium of the baby from the parents' MediSave. So you see the MediSave then comes in extremely handy. So it's actually cash-free as far as the parents are concerned. Although Medisave, of course, is their own money.
Right.
But Medifund, of course, is a government scheme, which is the taxpayers don't have to do anything. So when you're in trouble, then you apply, and then of course we look at your family background. If you really need help, then Medifund will comes in very handy.
Mm-hmm. What happens if you're unable to keep up with your payments into that Medisave compulsory fund? I mean, do most Singaporeans have enough money in there so that they can then pay for their treatment when they have to?
Yeah, because it is a percentage of salary. So let's say, in fact, the rate is generally about 6%. So let's say somebody earning $1,000 a month. So 6% every month is $60. So the enforcement is done through the employer. So if the employer is then required, mandated to pay this 6% into the Medisave account. And the employer, if he does not do so, he is actually shortchanging his workers. So we can then take the employer to court for shortchanging the employee. Yeah. So it is done, it is enforced that way, and therefore compliance is practically 100%. Mm-hmm. Of course, a small group, the self-employed, that's a bit troublesome, because then you are your own employer. And if I sue the employer, means I'm suing you, which is of course a bit tricky because you bring a person to court for not saving. So therefore it is a bit troublesome. And there we enforce it through a licensing system, because most self-employed will need some sort of occupational license to perform. For example, let's say you're a taxi driver, you need a license. If you are a hawker selling food on the roadside, you also need a license. So license have to be renewed every year. So before renewal, we'll check, have you paid into your own Medisave? If you have not, then we'll remind you to pay. Otherwise, your license may not be renewed. So it works.
Who pays for healthcare in Singapore?
It's a joint responsibility. So we make sure patients pay some, government pays a lot, employer pays some depending on your employment terms, and of course insurers if you buy MediShield. And over and above MediShield, you can also buy private insurance, because MediShield is a government scheme, therefore you need to take care of the basic hospitalization. But there are people who want better terms, more luxurious ward accommodation. Then of course you buy a bigger insurer, and that you get from the private insurance.
Right, and what happens if Singaporeans do need some kind of urgent medical surgery and they only have Medisave? What do they do if they can't afford MediShield and Medifund and all of these other kind of luxurious sort of private attachments that can be purchased?
Of course, urgent treatment will be treated immediately. We settle the financial account later. This is a legacy that we got it from the British, because we started off as a British colony. So upon independence, it was a national health service type. So the main base of our healthcare system is still taxation funded, and therefore access to care, rich or poor, is available to every Singaporean. So that is how we built up our healthcare system.
So in some ways you suffer from some of the problems that the United Kingdom suffers from in terms of its universal healthcare provision, long waiting lists, even though it's paid for up front?
Yes and no. I think I would describe our system not purely British, because it's a hybrid, and I think being a new country, we have the advantage of learning positive lessons from other countries, as well as pitfalls that we can avoid. So although we started off as a British NHS taxation funded system, and therefore do not have the problem of US, for example, a significant minority who cannot afford insurance, and therefore they are uninsured or uninsurable. So we avoided that problem, but we also try to avoid the British problem of a long waiting list, because it is nationalized healthcare. So over the years, we have grafted into this British model many important elements of the American healthcare system. That's why we have insurance, and that's why we allow a very dynamic private sector to coexist, which actually compete with the public sector side by side. Mm-hmm. So I think that is a major difference between our system and the British. So it is really a hybrid. I like to believe we have gotten the best of elements from the British system, the US system. And of course, we innovate on our own. And the 3 M's that we talked about just now is very much a Singapore invention, which I think allows this hybrid system to work even better.